3 times more expensive than pharmaceuticals. So for example, when Tagamet first came out, most of you know what Tagamet is, it was the first drug to treat ulcer disease. Now, you could take that pill, cost about $1,000 a year for 2 years. That was the average patient needing it that long. Or you could have a $25,000 operation and be out of work a month. $2,000 versus $25,000, you can kind of see the difference. So this is why pharmaceuticals can be very important. Now the next slide basically talks about other costs of losing half of our innovations. And the cost in lives is something I really want you to look at. Depending on the assumptions that you make, between 4 million and 16 million people have lost their lives prematurely because of this loss of innovation. So potentially this is, many times more than even the cost due to delays. And healthcare costs are important too, because there's a money factor as well as you lose work time and have to pay for surgery instead of pharmaceuticals. So, it's a significant cost every year, as you can see, between, what it costs for paying these extras and how much your annual bill for healthcare is. In fact, if you go to the next slide, you can see we've kind of calculated this for you to make life easy. I know I'm not showing you these graphs and things, so you have to study it. The bottom line is 25 to 55% of today's healthcare costs are there because we lost the innovation in the pharmaceutical field. And you know what? I haven't even told you the bad news yet. Yeah, it gets worse. Let's talk about the next slide. I'm going to summarize some of this and then get to the really bad news. So we know that these Kefauver-Harris amendments account for about 85% of current pharmaceutical prices. They kill, depending on what assumptions you make, probably over 100 times more people a year than they save. And they probably doubled the current cost of health care. Now you saw, I said 25 to 50%, 55% the other slide. Why did I say that? Because I left out the big thing. And that's this shift from prevention to treatment. Let me give you an example. We were poised in the 1960s to have a golden age of healthcare. The first one-a-day multiple vitamins had come out from the pharmaceutical companies, not the nutraceutical companies. But what happened is after the 62 amendments, the pharmaceutical companies had to choose FDA-approved drugs or nutritional products, and they chose, I think, the only thing they could, based on the economics of it, the drugs. Now, here's what happened to vitamins. In the 1980s, we realized that folic acid, a B vitamin, could prevent spina bifida and a lot of other what we call neural tube defects. These birth defects are so bad that most of the children have to be institutionalized. And you can test for it in the womb, so many are aborted. Nevertheless, the FDA told the folic acid manufacturers that if they talked about this, that they would be shut down. And this was even after the Center for Disease Control, another government agency, started making that recommendation. It wasn't really until the 90s that young women became aware that they should take this simple B vitamin to prevent these neural tube defects. So we had about 25,000 babies born with birth defects that they didn't need to, and many more aborted because prevention is not allowed under the FDA rules. Because for the folic acid manufacturers to prevent these birth defects, they had to go through this huge development process, this costly development process, so they could make the treatment claim or the health claim that folic acid would prevent birth defects. So since it's not patented, there's no way for the manufacturer to recover the cost, so they don't do it. So we have this great shift. Now, one enterprising company decided that there was a natural product that they would jump through the hoops for, and that was fish oil. Fish oil, for those of you who haven't heard, is great stuff. I don't have time to get into that at the moment. But this company decided it would go through all the hoops, and it did. And it got FDA-approved fish oil, and now goes to doctors and tells them that their product is the only one that is FDA-approved to prevent all these cardiovascular problems that fish oil is known to prevent. So if you get, I mean, the doctors aren't allowed to have Walmart come in and tell them that they have exactly the same product for a quarter of the price. So what the patients end up doing is they pay a copay that's about the same price if they would pay at Walmart. And then their insurance company pays 3 to 4 times that much, increasing our healthcare costs further. Yes, okay. So I'm making this point, and we can go to the next slide so I can conclude, because as you can see, this excess regulation has great impact, and it's not just in the pharmaceutical industry, it's in every part of the healthcare system. It's just that because pharmaceuticals are nationally regulated, I can give you some estimates of how bad it is. But my fellow panelists can tell you some horror stories about what happens in their sectors of healthcare, and I believe the costs are about the same. So, you know, basically, it's the excess regulation that's the problem. And unless we bring this into the debate, we're never going to have a satisfactory solution to the healthcare crisis, because as long as costs keep going up, there's going to come a time when individuals can't pay, insurance companies can't pay, or the government can't pay, because it's just going up all the time.